Welcome to The Explainer. Today, we're diving into something you've probably heard of or maybe even experienced, but you might not know it by name. We're talking about one of the most common culprits behind foodborne illness, Campylobacter infections.
You know the feeling, right? You have an amazing meal, maybe a great summer barbecue with friends, but a day or two later, you are just not feeling right. Sometimes it's more than just a 24-hour bug, and there's a very specific reason for it.
And that reason could very well be a bacterium called Campylobacter. It's a name that might not roll off the tongue, but it is incredibly common, and honestly, understanding what it is the first step to making sure you avoid it.
So, let's get right into it. What exactly is this bacteria that causes so much trouble for so many people?
Well, the species we're usually dealing with is called Campylobacter jejuni. Its whole mission in life is to get into your digestive tract and cause inflammation in your colon, a condition you might hear a doctor call colitis.
And while anyone can get sick from this, it's especially tough on the little ones. In fact, it's a major cause of diarrhea for children who are between 1 and 5 years old.
Okay, so that begs the question, if it's so common, where is it all coming from? Let's play detective for a minute and trace the path of this bacteria, right from its source, all the way to our kitchens.
So it turns out, the bacteria lives pretty comfortably in the digestive tracts of a lot of farm animals. We're talking about cattle, sheep, pigs, and especially fowl. Yep, chickens and turkeys are some of the biggest carriers.
And the way it gets to us is surprisingly direct. So the bacteria starts out in the animal. Then, during meat processing, it can get onto the meat itself or even contaminate milk or water. From there, it's just one step away from infecting humans who eat or drink those contaminated products.
So what does this mean for you in your daily life? Well, the biggest risks come from eating undercooked poultry. You've got to be so careful with chicken, or drinking things like unpasteurized milk. But it's also about simple cross-contamination right in your own kitchen. And get this, you can even pick it up from contact with an infected pet, like a brand new puppy.
Okay, so let's say the worst happens and you've been exposed. What comes next? Let's walk through the timeline and symptoms of what a typical infection looks and feels like.
One of the tricky things about Campylobacter is it doesn't hit you right away. There's an incubation period. Symptoms usually don't even start for about 2 to 5 days after you were exposed. The good news, though, most people are feeling back to normal in about a week.
But that week can be pretty miserable. We're talking about severe abdominal pain, really bad diarrhea that can sometimes even be bloody, and then just that general awful feeling of nausea, body aches, and of course, a fever. And that fever is no joke. It can get surprisingly high, sometimes spiking all the way up to 104 degrees Fahrenheit or 40 degrees Celsius. That's a huge sign that your body is in a serious fight with an infection. Now, for most people, the story ends right there. You feel awful, you recover, and you move on. But in a small number of cases, things can get more complicated, and it's important to know what those rare possibilities are.
And let me be really clear, a full recovery is the norm here. Complications are absolutely the exception, not the rule. But because they can be serious, it's worth knowing what to look out for.
First up is something called bacteremia. This is what happens when the bacteria escapes the gut and actually gets into the bloodstream. For most healthy people, your immune system clears it out. But for someone with a weakened immune system, maybe from HIV, diabetes, or cancer, it can become a much bigger problem, leading to fevers and even infections in other organs.
The next complication is extremely rare. We're talking about only 1 in every 1,000 cases of Campylobacter, potentially leading to a nerve disorder called Guillain-Barré syndrome.
So what is that? Well, it's a condition where your body's own immune system basically goes haywire. The antibodies that your body created to fight the bacteria get confused and mistakenly start attacking your own nerves. This can cause weakness and, in the most severe cases, even paralysis.
And there's one more potential issue, and it's called reactive arthritis. This is an inflammation of your joints, like in your knee, that can pop up days or even weeks after you've already recovered from all the stomach issues.
Okay, so if you think you might have it, what's the next step? Let's take a look at how doctors actually confirm that it's Campylobacter and what the path to getting better looks like. Diagnosing it is usually pretty direct. A doctor will test a stool sample. In the lab, they can either try to grow the bacteria from that sample, or they can use a much faster molecular test. You might have heard of it, a PCR test, to look for the bacteria's genetic material. And if they're worried about a bloodstream infection, they'll do a blood culture. When it comes to treatment, there are really 2 different paths. For most people, it's all about supportive care. Just rest and replace all the fluids you're losing. But for the more severe cases, like if there's a really high fever or bloody diarrhea, or for people with weakened immune systems, a doctor might prescribe a short course of an antibiotic like azithromycin.
So what's the bottom line here? Campylobacter is definitely common, and it's absolutely no fun, but it's usually a brief illness. Your most powerful tool against it isn't medicine, it's knowledge. Understanding where it comes from is your best defense.
Which really leaves us with a final thought to take with you. After everything we've just talked about, how this bacteria spreads from place to place, ask yourself honestly, is your kitchen really set up to keep you and your family safe?